Our presentation will deal on population growth, the relationship of population with poverty and reproductive health, the relationship of population with the environment, how urbanization affects the population and development, and so forth and so on. To start with, let us acknowledge that over the years, our population has been growing at an unsustainable rate, even as it is actually coming down. Okay? You will see that in the 1970s, there were about 37 million Filipinos. But in 2007, in the last population census, we were an estimated 88.6 million. And at the rate our population growth is continuing, even though, as you see, it might be going down a little bit, from 2.78 in 1970 to 2.04 in 2007, the population is still projected to reach more than 140 million by 2040. That's less than 30 years away. The population growth rate is not the same in all regions, and here you see that while the population growth rate overall has declined from 2.36% per annum in 2000 to 2.04% per annum in 2007, there are regions that actually register population growth rates higher than the national average. For example, in ARM, the population growth rate is more than 2.5 times the population growth rate overall, with Maguindanao and Basilan showing the highest population growth rates of 7% and 6.4% per annum. In Metro Manila, again, the population growth rate is volatile and uneven, such that in some years there is an increase in the population of some cities or municipalities and a reduction in others. This is mainly due to the fact that people in Metro Manila can move very easily from one municipality or city to the next. And they will go where the jobs are. So because the economic growth is better in places like Taguig, for example, they will go there, and the population growth rate in Taguig will go up. Not because more children are born there every day, but because people migrate from cities such as Manila, for example, where the opportunities are not so great anymore. Along with the increase in population is an increase in poverty rate, such that in ARM, in regions 8, 5, 9, and 13, the poverty incidence is higher than the national average. While, as we see, the poverty rate is going down relatively, in absolute terms, there are more poor people now than ever before. Siyempre, kasi dumadami yung tao eh. So, miski na yung percentage bumababa, dumadami pa rin yung mahirap. And one of the factors that is being affected by the high population growth rate is urban poverty and urbanization. In 2000, 52% of the population lived in urban areas, and this has increased to 65% in 2008. In Metro Manila, more than 50% of its 11 million people live in slums or depressed areas. Comparing ourselves to Thailand as far as population and growth, economic growth are concerned, you can see that in the 1950s, there were even less people. There were about the same number of people in the Philippines as well as in Thailand. Okay, so at that time, there were about 2 million people in the Philippines and about, there were about 20 million in the Philippines and the same 20 million in Thailand. And at the time, the gross domestic product of Thailand was even lower than our own gross domestic product growth. Over the years, however, Thailand has instituted a good population management program such that by this time, there are 20 million less Thais than Filipinos. And on the other hand, our gross domestic product is now half of what the gross domestic product of Thailand is. So, on a macro level, you can see the relationship between population and economic state of the country. When it comes to families, you can also demonstrate the same thing. The larger the family, the higher the poverty incidence. And this has not changed over the past quarter century. Poverty incidence among households with fewer children has dropped, while among households with many children, it has risen. The more children you have, the less you have for each child. And this is illustrated in this graph of family size versus investments in education and health. In a family with only one child, the average expenditure for education for that child is more than 5,500 pesos per year. In a family with 9 children, the average expenditure for education per year is only 682 pesos. In a family with 1 child, the average health expenditure for that child per year is 1,700 pesos. In a family with 9 children, the average health expenditure for each child is 150 pesos per year. No wonder that in large families, many children are out of school and many children are unhealthy and malnourished. This is also reflected in the relationship between the number of children and hunger incidence. Here you note that overall, in surveys done by the social weather stations, the number of severely hungry individuals, ang definition ng social weather station is you are severely hungry when you have involuntary ito, no? Hindi yung nagdidieta, kung hindi yung walang makain talaga. The number of severely hungry families is 3.2%. Okay, and they're hungry, and that means they have practically nothing to eat very often for the last 3 months. That's the surveys for 3 months. If the family is small, with 1 to 2 children, the number of severely hungry goes down to 2%. But if the family is big, have 7 to 8 children, for example, the number of severely hungry doubles. Well, hindi mo mahirap isipin yun di ba? Parang arithmetic lang yan. Okay. So, apart from bad effect on the general health of members of the family, we also note that there is an effect on the reproductive health of families. And here, we see the relationship of income with reproductive health indicators. Ang nakikita natin dito, among the women who are rich or well-off or affluent, okay, like all of us here, we have exactly the number of children that we want. But in families that are poor, they have 3 or 2 extra children per family that they actually don't want. So yung mga mahihirap, merong 6 na anak, pero actually, ang gusto nila, 3 lang. Okay. Also, because of this, you can see that the birth interval is much shorter among the poor than it is among the rich. Yung mga mahihirap, on the average, every 2 years or so, may anak na bago. Yung mga mayayaman, ang interval is almost 3 years. More than 3 years, almost 4.5 years. Or more than 4.5. Ano ba yun? 12 times 3, 36 months, di ba? So more than 3 years. Okay. Among the poor, again, early childbearing is very frequent. The early childbearing means bearing the woman or the girl bearing a child before the age of 18. Among the poor, 44 out of every 100 women below the age of 18 have started childbearing. Among the rich, only 13 out of every 100. And this is because the use of contraceptives is more prevalent among the rich than it is among the poor, along with the fact that the rich actually marry much later than the poor. This results in a very poor maternal mortality ratio. And one of the Millennium Development Goals is improving maternal health. That is Millennium Development Goal number 5. This graph shows us our performance, that's the blue line, versus our target. So sa ngayon, mukhang by 2015, which is when we have committed to reduce our maternal mortality ratio by 2/3, hindi natin kayang abutin yon. By 75% pala, from 209 to 52 per 100,000 live births. Okay. There are other targets and goals associated with Millennium Development Goal number 5, aside from maternal mortality ratio. One of them is attendance at birth by a skilled health professional. When we started in 1993, 52.8% of births were being attended by a health personnel. At the moment, 62% are being attended. Our target is 90. Pero that only tells you half of the story, actually. Diba? Kasi if you again divide women by income groups, you will see that the richest among us, lahat ang kanilang panganganak attended by doctors, nurses, or midwives. Mostly doctors, actually. But among the poor, only 1 out of every 4 births are attended by a skilled health personnel. And among the poor, the skilled health personnel that we are talking about is not a doctor, it's a midwife. Here you also note that we are way below target for contraceptive use among married women and women of reproductive age. We are below target for reducing adolescent birth rate. We are also below target for antenatal care coverage, although that particular goal I think we are going to meet. and we are certainly below target for reducing unmet need for family planning. As far as the youth are concerned, hindi ko na kailangan pakita itong pyramid na to sa inyo. Alam nyo na mas marami ang bata kesa sa matanda. Whether it was in 1950, when we were less than 20 million, or now, when we are more than 93 million. This is a very conservative estimate. Actually, the CIA estimated that the Philippine population is 101,800,000 by July of this year. Okay? So if you add another 2.1 million, we will be almost 104 million by next year. And most of us are young. The median age of the population is 22.9 years. Ibig sabihin, 50% of the population is 22.9 years or below, and 50% are more than 22.9 years. We also have a large child dependency ratio compared to Malaysia, Brunei, even Vietnam. Meaning to say, for every 100 working individuals or adults between the ages of 15 to 65, there are many more children aged 0 to 15 who are dependent on these working age Filipinos for care. Okay. Siyempre, pag dumadami ang tao, dumadami ang paggasta ng resources, di ba? Mas maraming pagkain ang kailangan, mas maraming tubig ang kailangan, mas maraming puno ang cut down. And this graph shows you a comparison between the ecological footprint, which reflects the number of people in the Philippines, and the biocapacity or the carrying capacity of the Philippines compared to the number of people. What you see here is, in the 1970s, by certain calculations, we actually exceeded our biocapacity or carrying capacity. And the result of that is pahirap ng pahirap ang buhay dito sa ating bansa. And again, di man lang kailangan ipakita ito. Alam nyo na yan pag nakikita nyo yung mga tao sa inyong mga communities. At the moment, we only have less than 10% of our forest cover and coral reefs. About 90% of untreated domestic wastewater, yung mga galing sa banyo natin, sa toilet natin, napapapunta sa groundwater na later on, yun ang ating source of water. 90% of the untreated domestic wastewater threatens our water bodies. Diseases from polluted water account for 31% of the illnesses in the country. And there's only less than 2 cubic meters of fresh water available to each of us, making the country the second to the lowest among Southeast Asian countries with fresh water availability. So, ngayon, kinukulang tayo sa oil. Susunod dyan, water is the next oil. Overall, 2 out of every 3 of us are engaged in unsustainable environmental and natural resource usage. Pag hindi natin na-sustain ang resources natin, it will come to a point where there will be nothing left for us. Most of us come to urban areas because that's where the money is, di ba? Parang yung bank robbery yan. Why did you rob the bank, sabi? Because the money is there. Okay, the percentage of urban population is increasing. It has increased from about 32% in the 1960s to 65% in 2008. And by 2030, sandali na lang yun, no? Less than 20 years, it is projected that most people in the Philippines will be living in urban areas. Wala nang magsasaka, dadami ang kakain na lang ng kakain. The urbanization always follows economic growth in the area. And aside from the National Capital Region, Central Luzon, and Southern Tagalog, Central Visayas is a region where urbanization is much more rapid than anywhere else in the country. Let's just skip that. Merong magandang slide doon, sabi niya ganon. Inaantay na lang niya yung city na dumating sa kanya kasi yan yung urban sprawl. Diba? Palaki ng palaki yung city eh. So, miski na yung nandun sa probinsya dati, later on, nakatira na rin siya sa city. Natatandaan ko when I was growing up in Pasay City, I was growing up in a place where we used to have carabaos. We used to have ducks and chicken there. Now, my grandchildren, they don't know how a carabao looks except from pictures in the picture books. Kasi yung areas na rural nung araw, like Muntinlupa where I live now and Pasay where I used to live, they used to be rural areas. Pero ngayon, urban areas na rin sila. In Luzon, the most preferred destinations for in-migration would be the NCR and Calabar zone for work and residential purposes, in the Visayas, Central Visayas, and Western Visayas, and in Mindanao, Northern Mindanao, where Cagayan de Oro is, and Southern Mindanao, where Davao City is. Dahil sa dami ng tao, kulang ang opportunities, a lot of us have to go abroad to seek for better jobs and other opportunities. At the moment, it is estimated that there are nearly 9 million Filipinos abroad. The number has sort of stabilized kasi nagsasara na yung mga trabaho sa Amerika, tsaka sa Middle East. We're going to have to contend with the fact that we are going to have to give these people jobs here and not depend so much on overseas work. Siyempre, most Filipino immigrants are in the United States. Okay, these are people who have gone there and are considered as permanent residents in those areas. A considerable number are also in Canada and Australia. A few are in places like New Zealand and some European states. Our workers abroad, a very rich resource for the Philippines if only we could provide them with the opportunities, are young. Their median age is 32 years, with the females much younger than the males. And more of them are going abroad. Okay. Many of them are highly educated, but are in fact doing menial and skilled work. So we have what is really known as an education-occupation mismatch. These overseas Filipinos bring in to the Philippines about 1/10 of our gross national product. Okay? Every year they bring in, last year they brought in $18.8 billion to the Philippines. And the amount of money that they have been remitting continues to go up. Still, their families belong to the lower wealth quintiles. In other words, miski na padala ng pera dito, kulang pa rin. Hindi pa rin sila makaangat. There is still very little upward mobility for these OFW families. Siguro they'll go from E to D or maybe D to lower C. But aspiring to go to income class upper C, B, or A is not something that is attainable for most OFW families. Overseas work is a double-edged sword. There are gains and there are pains from overseas work. For the individual, it brings increased self-confidence and bargaining position in the family and the community. But on the other hand, it has a social cost, which is the exploitation, particularly of women, and their discrimination in the countries where they work. Overseas employment also brings increased household income and therefore increased consumption of basic needs, as well as an increased ability to save and invest. But the social cost is a reconfiguration in family roles, and in fact, a breakdown in the family structure. And you know, all of you have stories of yung asawa ni Pedro, 2 taon nang wala, pero nanganak si Mrs. Meron din dyan yung asawa ni Maria, na 3 taon nang wala, may bago ng asawa. Diba? At yung mga anak nila, imbis na gastusin sa eskwela at mag-aral mabuti, yung pera na pinapadala ng nanay or tatay, ay ginagastos sa videoke, bar, or sa pagbili ng magarang cellphone. For the community, when a family has a higher household income, syempre, gagastusin niya yun. So, in the community, there is a spillover of this household income. However, there are actually conflicting findings on the effect of remittances on poverty and inequality. In other words, kahit maraming perang pumasok sa bansa, hindi ibig sabihin na mawawala ang kahirapan at mawawala ang inequality. And while they contribute to economic growth, it reduces the talent and the human talent and resources that we have within our country. So these are the exchanges, the trade-offs in overseas employment. We have many population challenges, and they include managing population growth to alleviate poverty. They, of course, include efficient utilization of natural resources. Kasi, sabi ko nga pa, arithmetic lang yan eh, di ba? Parang multiplication. 10 equals 2 times 5. Kung gusto mo panatiliin yung 10, at babawasan mo yung 5, kailangan na gawin mong 4, kailangan yung 2 gawin mong 2.5. Kung gusto mong mas mataas yung 10, gawin mong 20, kailangan either yung 2 gawin mong 4 or yung 5 gawin mong 10. Ganun lang yon, palaging may trade-off. So we need also to manage the in-migration such that not everybody is in the city, but there are people left in the rural areas. Therefore, we need to provide adequate local employment and investment opportunities everywhere in the Philippines in order to manage urban-rural migration, as well as to make overseas migration a matter of choice rather than a necessity. In this instance, time is our ally, but it can also be our enemy if we do not do something about it. look at the doubling time of the population compared to the population growth rate. At a population growth rate of 1%, the doubling time of the population is 70 years. At a population growth rate of 2, which is what we currently have, the doubling time of the population is 35 years. In other words, at a population growth rate of 2, our 100 million people will become 200 million by 2040 or so. 2041, diba? Or something like that. But if we bring down our population growth rate to 1%, our population of 100 million will become 200 million only in 2080 or so. That will give us a lot of breathing space to develop the economy and establish the necessary institutions to accommodate the population at a higher quality of life, which is what the first executive director of the Unfpa, as paraphrased by Congressman Lagman, has said. No development can occur if we do not put population in our agenda. So miski na ako, who favors the reproductive health bill, principally because I think it is a human rights issue, appreciate the fact that a very important secondary gain of improved maternal and reproductive health is improved population growth rate and sustainable development. Thank you very much.